nobody rallies around their own like rural either. I mean, you see this
That's true.
all the time when there's somebody in the community gets diagnosed with cancer. The entire community rallies behind them and celebrates them and supports them, and you don't get that in an urban place.
Well, hey, Kasey, just welcome to the Recur Effect podcast. We're so excited to have you. My name is Ryan Day, and I'm the CEO of Recur. We have an association management system that we built, and we help associations like RHAU, the Rural Healthcare Association of Utah, and of which you are the
Executive director.
And what does that mean? What's the executive director of the Rural Healthcare Association of Utah?
Yeah, so it's Rural Health Association of Utah.
Rural Health Association.
Yeah, and RHAU for short.
RHAU.
And I'll say RHAU's been around for about 25 years, but it's been a small association during that time. And I'm actually the first full-time employee that RHAU has had.
Wow.
And so right now being executive director means I wear every hat. So I do our finances, I do our marketing, I do our programming, I do our membership management. It all falls back to me. I've got a board that supports me. I've got a couple part-time people that help with a couple things like our events. But the rest of it falls back on me, which makes tools like Recur really critical to what I do.
Wow. So everybody else that participates is a volunteer, and you're the only employee of the healthcare for the health association.
Correct.
Wow. And how did you get involved in this?
So I was working at the Utah Center for Rural Health at SUU before this, and that's actually who used to assist with RHAU. And so I got tagged into RHAU kind of volunteer basis there at SUU, and I actually got to take over control of our conference and start making some adjustments and some changes that fostered a lot of growth for RHAU. We weren't well known in the state. We're still not super well known. We're getting some momentum behind us.
How do people find out about you? If I'm a doctor in a rural town, which by the way, I grew up in a small town in southern Utah. I'm from Monticello.
I know Monticello.
Yep, that's my hometown.
Yeah.
If I'm a doctor and I'm in Monticello, how do I connect up with RHAU and you and be part of this?
So there's a few, I mean, you can join online. We have our website, RHAU.org, RHAU.org. It's got, we do our updates on there with our newsletters and news releases. There's information about our annual conference and golf tournament there, our board, advisory council, advocacy committee. You can find most anything about RHAU there. And we have social media as well that we run. That you can connect in there. But one of the best way for people to get involved at this juncture is participating in our annual conference. And then we are actually prepping a first of its kind RHAU Tech Summit this spring that'll take place in St. George as well.
Well, that brings up a couple of questions. Number one, can you tell us about the conference? Because your annual conference does sound interesting. It's in November, if I remember correct.
Yep, November 12th and 13th.
What does a tech summit for RHAU look like? What does that mean? So
let me start with the annual conference. That's kind of our annual meeting with our members. We have a networking event, some pre-conference workshops. We do our annual awards there for RHAU, which, by the way, we're recognizing a physician from Monticello this year is our Rural Provider of the Year. I can't provide any more details than that at this point. It hasn't been announced yet, but and then the next day is kind of your standard conference. We have keynotes, breakouts, information tables, research posters. So it's an opportunity to provide continuing education to providers and healthcare professionals. We have ACHE for executives as well, and then to network and come together and learn about the issues that we're encountering in rural Utah and what's being done to advance those issues. And this year's conference will especially be a special conference for us with everything that's happening at the national level with the One Big Beautiful Bill and the potential cuts coming to Medicaid, but then the Rural Health Transformation Program as well, which RHAU is involved with at a state level right now in preparing Utah's application for that. So, kind of a silver lining to the concerns about the Medicaid cuts that are coming is that the federal government recognized the disproportionate impact it would have on rural and have created a fund to help us kind of innovate and transform how we do healthcare in rural Utah and create a more efficient system.
Makes sense.
So,
I always, growing up in a small town, I always wondered how a small town in
Mhm.
rural Utah, how does that type of a situation attract a doctor or a
Yeah,
healthcare physician to
a
come in?
lot of times it's kids that grew up in those communities that go off and get their training and come back. We
Is that
call
right?
that, yeah, we call that growing your own. They don't always end up back in the same community they grew up in, but most of our rural providers in Utah have a connection back to rural Utah. That's where they grew up. But then we do get providers that come in that are not from rural, and there's a lot of charm to living in a rural community. It is a little bit slower lifestyle, and you do get to know as a healthcare provider, you do get to know your patients more. You get more ingrained into the community, and some people really enjoy that aspect of it.
It's interesting. So once you kind of have that rural Utah, you grow up, you feel it,
Mhm.
and you kind of come back to it at some point.
Yeah, yeah,
That's
no.
interesting.
It's a different dynamic. You see your patients at the grocery store, at church on Sunday. You go to the sporting events. Your kids are playing with their kids. It's a different world than it is working and living in urban.
Wow, that's
Yeah.
fantastic.
Hmm.
Great insights. Which kind of begs the question: you've got all these small towns in Utah.
Hmm.
How do you engage with these members outside of bringing them to your conference or bringing them in?
Yeah,
How do you
that's
engage with them?
that's the fun part. I actually spent my summer traveling over 6,500 miles across rural Utah, out
Wow.
visiting. I've visited pretty much every rural town in Utah, and even the ones that the map says are towns that aren't really towns.
So
So,
you're driving all over, visiting them, talking
yeah.
to these doctors and physicians, and
Hmm. Yeah,
wow.
getting an understanding for what their issues are, and letting them know that RHAU's out here to support. One of the big components about what we do is advocacy. We work with the state legislator to help them understand what's happening in rural
Nice.
Utah, and Medicaid as well for policy decisions. And that's the best way to understand, what's really happening out in those communities, to get out there and visit.
Wow. So with RHAU, who is it that you target? Like, who would be a great member? Would it be anybody involved in healthcare in rural Utah, or is it strictly for physicians? Is it like if I am a I don't know, somebody that does intake somewhere,
Mhm.
but I'm at the hospital in Monticello, for example, would I qualify to be part of RHAU?
That is a great question, Ryan. Yes, everybody working in healthcare would. That's actually what makes RHAU unique among the professional associations in the healthcare landscape. Is most professional associations focus either on a specific profession in healthcare. So, like, you have a Utah Medical Association, Dental Association, Nursing Association, PA Association, Public Health Association. But then you also have the other side of the coin, which are the associations that focus on a specific setting of care, like the FQHCs and community health centers, or the hospitals, or long-term care facilities. What makes RHAU unique, twofold, what makes RHAU unique is, one, we work in all of those settings. We
Wow.
are interdisciplinary, which is great because healthcare tends to silo itself, and we break through those silos by bringing everybody together.
Nice.
But the other aspect of that is we are focused exclusively on what's happening in rural Utah. And so those associations are statewide. And, if you look at the demographics in Utah, about 85% of the state lives in urban, if you count St. George's urban. But the landmass, it's about 94% of the landmass is rural.
Yes.
And that 6 to 10%, depending on how you slice that pie for rural and urban with St. George, roughly 10% of the landmass in the state holds 85-90% of the population.
Wow.
So we do work with the urban counterparts. We work with those associations. We work with our statewide organizations to help the groups that are trying to bring resources into rural and design programming to help rural. But our focus is 100% on rural. So those minorities, those groups that end up being a minority in their other professional associations, are our focal point at RHAU.
That's amazing. So if I want to join, what does it cost?
Mhm.
And is it something that I pay for? Is it something maybe my organization I work for pays for?
Mhm.
And then also, I'm assuming that it gives me access to all kinds of
Mhm.
information, plus going to the conferences and stuff. But what does it cost me to
Yeah,
join?
individuals can join RHAU. It's $50 a year. We,
Oh,
we try to keep the cost as low as possible.
that's not very much.
No, and we try to keep that cost as low as possible because resources are not plentiful in rural. So we don't want funding to be a constraint to being able to participate.
Nice.
We do also do organizational memberships. There's different tiers for that, but it essentially breaks down to anywhere from 3 to 100 people from your organization can join. And it averages out at about $40 a person when you do it by organization.
Wow.
So who pays for that? It depends on your organization. If you want to be part of RHAU as an individual, you can pay for that on your own, or your organization may be willing to cover the cost of your individual registration or an organizational registration as well as a member.
Wow.
And it gets you access to our monthly newsletters, to our education components. It gets you discounts on our events. And then it provides the funding for RHAU to come out. We focus on working with the members specifically when they're encountering issues and things that we can come out and help with.
Wow. And so how many members do you have within the association right now?
Approximately 300, but we hope that's a high for us. We've not really been that high in the past, and we hope to see that number grow significantly over the next few years as more people become aware of the association.
That's fantastic. And then when you have an event, I'm assuming your events are pretty big deal. You got all kinds of facilities to manage. You got check-ins to manage. Do you get a lot of volunteers helping you out with that? And how do people volunteer to help you with that?
We do.
And other things?
Yeah, we do. So we have a event manager who has a 25-year track history of volunteers here in St. George. So she pulls from that group that is well established to come out and help. But we would be open to other folks that want to volunteer. You could email us at info@rhau.org and let us know you're interested, and we can definitely coordinate that. And we do have student internship programs. For instance, this year's RHAU conference that's coming up next month, we have, I think, 6 student interns participating in that conference.
Wow. So that's fantastic.
Yeah, it's a great opportunity for them.
And do you just pull from any college, or mostly from Dixie, or Utah Tech now? But
right now they're all Utah Tech students, but one of the components of RHAU that we're working on growing is our student chapter. And students, I should mention that as well, with membership, students can join for $25 a year, and they get access to our student chapter, which has additional opportunities. And we're working on growing that out.
Nice.
But our hope is over the next few years to start setting up chapters on more campuses and being able to offer internship opportunities, leadership opportunities, and networking opportunities for those students so that they can start to interact with the rural healthcare workforce while they're still in school, in the hopes we can get them to join us when they graduate.
That's fantastic. Hey, this is great information. And then I just have to know, Kasey, as you've been working in rural Utah in the health industry, what's been some of the best experiences you've had going around to the small towns and talking to people? What makes it fun for you?
Rural Utah is a special place, Ryan. People out there are just great.
Well, I know it's a special place.
It is. I'll tell you, one of my favorite characteristics of rural Utah is the humor. People are usually pretty laid back and getting to interact with the directors of facilities and their staff in kind of informal settings and seeing the dynamic that they have and how much they care about one another and how those workforces are really family to each other. That's inspiring. And every time I go out and visit those facilities, I come back with a renewed desire to support those groups, because anybody that's out living and working rural rural Utah's healthcare workforce, they are giving it everything they have.
Wow.
And I want to do the same for them as the association, give everything we've got to them as well and help them be successful.
That's fantastic. This is a fantastic association, and it is near and dear to my heart, because that's, like I said, I've grown up in a small town. Rural Utah is what I consider to be my home. I would move to just about any small town in Utah. Now, convincing my wife Amanda to do that would be a little different.
I'm there with you. Yeah.
That's probably what you find with most people that grow up in a small town. Well, Kasey, I appreciate your time, and it's really good to get to know you. We do send our podcast out, and we're excited to get traction on it. You're our third interview on our podcast.
Thank you. Yeah.
And we just really appreciate you. It's been fantastic to get to know you.
Yeah. Well, and we didn't get to the question about the tech summit. If you wanted me to address
Oh, I
that.
apologize.
No, you're good.
I knew I'd asked you that question, but I would love
Yeah.
to hear more about that.
Yeah, so we're setting up this, there is a tech summit that happens in Utah around education, but there's not really anything happening around healthcare, which is a big gap considering, with the growth of AI tools in healthcare, there's a lot of help out there now with automation and note-taking tools and scribing tools that take a huge load off, especially for the small rural providers.
Are you talking like AI type tools that are helping out with some of
Yeah,
those?
tools that help transcribe your appointments and put the notes in for you into your EHR so you can review them and approve them, things like that. But automating, your check-in process and your paperwork processes as well to take some of that administrative burden off of those groups and create better efficiencies.
So when is your tech summit?
So it's it's April 9th and 10th, and that will be here in St. George as well.
Okay.
And we're partnering with Vasion, which was formerly Printer Logic.
Yep.
They're a global tech company that does AI and automation that started in St. George. And their CEO is also a rural kid from St. George. His family traces back to Milton, Utah,
Wow.
or from Utah. But so they've got a passion for this as well. As their company has grown globally, they still recognize the need at home and wanted to get involved. And so they approached RHAU about creating a first of its kind tech summit for the rural healthcare workforce so we can put our rural healthcare stakeholders in a room with global leaders in AI and technology and start to collaborate together on solutions that can be implemented to lift our healthcare systems in rural Utah. And it's an exciting time because with the Rural Health Transformation Program that's launching nationally as part of the One Big Beautiful Bill, there's funding available for new projects that wouldn't have been there without that funding. So it creates an unprecedented opportunity for us to come together and build solutions and systems in rural Utah that's going to elevate our healthcare system, increase our efficiencies, and improve health outcomes long term, and especially sustainability.
And it sounds like you've been working hard to start understanding that bill and to start helping out with these rural scenarios where you can get access to some of those federal funds.
Yeah, and also working hard on understanding the IT field. I am a rural kid myself, and we're late adopters of technology, and some of this stuff's new to me, and I'm learning about it. Recur has been a great example, learning about how that can streamline some of my processes and help me understand how people are engaging with us. It makes a big difference to have those tools, and if we can help alleviate some of the hesitation to get involved with using some of that AI and build systems that specifically meet the needs of rural Utah, it has the potential to change the game and really improve the way we do things.
I love it. Now, if somebody's a member, they paid their $50 membership fee. Does that give them access to the conference and to the tech summit, or
it gives them discounted prices?
Discounted price.
Yeah, you get a good little discount on the events, save a few $100s on attending. And then it also gets you access to other educational stuff that we're building as well.
Nice.
So
nice.
Yeah.
That fits a huge need. I just remember growing up and we would have doctor after doctor move in.
Yeah.
And they stay for a little while and then they move out. And I always wondered, well, how do they recruit these guys to come down here?
It's tough. And it's kind of a two-edged blade when it comes to that beauty of being more connected to your patients. That takes an emotional toll if you lose a patient, or if somebody's not doing well. That's harder on you because you know that person. And for some of these providers that come and set up shop and are there for 30 years, I mean, they're giving birth to kids, seeing them all the way through their years, and then seeing the tragedies that can happen for some of those folks. And that emotional strain can be hard. And so that's really where RHAU is focusing is, if we can get them to come out and be a part of the community, we feel like as an association, our job is to make it as easy as possible to be successful in that setting so that people aren't as burned out and they stay more long-term. There's less disruptions to our workforces and there's better satisfaction.
That's amazing. It sounds like you understand the scenarios really well. And I think that most people, unless they've lived in a small town, they don't get it. Don't really connect to that.
It's hard. And that's no offense to people that haven't been there, but it is a completely different lifestyle.
Wow.
And it's a whole different reality when you live in those communities and you live there long term. It's a tight knit community, and one of the benefits is everybody better. One of the downsides is everybody knows your business, right? That it's a hard piece of it, but nobody rallies around their own like rural either. I mean, you see this
That's true.
all the time when there's somebody in the community gets diagnosed with cancer. The entire community rallies behind them and celebrates them and supports them, and you don't get that in an urban place.
And then that happened to me. My dad had cancer when I was growing up, and the entire town. I mean, he passed away when I was 12, and the entire town actually shut down for everybody to go to his funeral. So
Yeah.
it's still a little bit near and dear to me what small towns mean and how we do take care of each other. So.
And it's like you have families in those communities for generations, and your grandparents knew each other, and your great grandparents knew each other, and you've been there since the start. And even for the folks that move in, you still see that heritage and that tradition, and that's just the grit that rural Utah had. It wasn't easy settling these areas, and it took a lot of grit to settle Utah, in the early days. And there's a lot of tradition and heritage that go into that. It's a special place.
That is fantastic.
It's a beautiful place to be. And when people catch that bug, even, there's one of my favorite providers is from Philadelphia, and he works in Penguins, Utah. He's been there for a couple decades at this point and just loves it. It's like you can fall in love with those little communities like that.
Wow.
You really can. But it's our job as an association to take care of those providers that fall in love with rural and make sure that they can sustain, because burnout and those struggles are real. And they need that support to be able to continue through and be successful.
Wow. Well, Kasey, just once again, just thanks so much for your time. We just wish you nothing but the best. And as a software provider, Recur, that you use, we're just glad to support you and glad to support the Rural Health Association of Utah. So just thank you so much for all that you do for us. Yeah. And we just look forward to having a good partnership with you going forward.
Same thing, Ryan. Thanks for having me today. And thank you for everything that your team does. And I'll just put a little plug for Recur. I've never had a software group that's so responsive. I really appreciate the support I get from Recur. And when I know the tool's newer, and when I've made suggestions to your team about things that would be helpful, they've added them in and they've fixed problems. And everything gets fixed very quickly if there's ever an issue, but the system works really well as it is. And it's been a game changer for us as an association, especially where we're small and I'm a one-person band right now. Recur helps me track data. It helps me carry out my processes. I do my registration through it. I do my sponsorships through it, my membership through it. It's an easy-to-use tool, and it's made a big difference for us.
Fantastic. That's amazing. Thanks so much, Kasey. Hopefully I'll catch up with you sometime. I'd love to come and maybe volunteer with you.
Sure. Yeah, we'd love to have you.
Just appreciate you. Thanks again, Kasey, and we'll end with that. So.